Hello and welcome to my channel. This lecture is about the pons, so let's start. The pons in French means a bridge, and actually it's a bridge between the two cerebellar hemispheres, not the cerebral, the cerebellar hemispheres. See, it's a bridge between the right and left cerebellar hemispheres. It contains descending fibers that synapse on pontine nuclei, then project to the opposite middle cerebellar peduncle. This is the beginning of the middle cerebellar peduncle. It has a basis pontus, the ventral part, and the dorsal part is the tegmentum, as you can see here. Note that there is a groove at the front. It's called the basilar groove. It's to accommodate the basilar artery, and the nerves you see here, this is the abducens nerve on the lower border of the pons, between the pons and medulla, and this area is called the cerebellopontine angle, in which there's the 7 and 8 cranial nerves, the facial and vestibulocochlear nerves. The nerve emerging here is the trigeminal nerve. The sensory root is bigger, being lateral to the motor root, which is smaller. This is the sensory root, and this is the motor root of the trigeminal nerve emerging from the ventral aspect of the pons. It contains the cranial nerve nuclei of the trigeminal nerve, the trigeminal nuclei, the sensory nucleus being lateral to the motor nucleus, which is medial. Contains the abducens nuclei, the facial nuclei, facial nerve nuclei, and the cochlear nuclei and vestibular nuclei. The cochlear nuclei are lateral, and vestibular nuclei are medial. Together they form the vestibulocochlear nerve. The internal structure of the pons, this is a cut section of the pons at a higher level. This is the superior cerebellar peduncle and superior medullary velum. This is the fourth ventricle, so this is dorsal, this is posterior, this is anterior. This is the middle cerebellar peduncle. Remember, I told you in these sections that the white matter appears dark in color and the gray matter appears light in color. So all these is gray matter. Note that this bundle of nerves, this is the corticospinal tract and corticobulbar tract, becomes dispersed at this region because they pass through the pontine nuclei. These are the pontine nuclei, the ones you see here, and these transverse fibers are the trapezoid body or trapezoid fibers, which is a connection between the two auditory pathways on the right and on the left. The pons has the corticospinal and corticobulbar or corticonuclear tracts and corticopontine fibers. The corticopontine fibers rely on the pontine nuclei and give rise to the pontocerebellar fibers that goes through the opposite or the contralateral middle cerebellar peduncle. I told you before that the corticospinal tract disperses because it passes through the pontine nuclei. The corticonuclear fibers to descend to ipsilateral and contralateral cranial nerve nuclei. The tegmentum pontus, which is this part, varies in the upper and lower parts. This is an upper section of the pons. Lower part, this is a lower section of the pons. As you can see here, the appearance of the facial nerve. This is the facial nerve curving around the abducens nucleus. So this is called the geniculum, and it protrudes in the floor of the fourth ventricle, as if you remember, as the facial colliculus. This is the facial nerve of the opposite side. This is the middle cerebellar peduncle and the corticospinal tract. Now, the MLF and the medial lemniscus are in the middle, and the medial lemniscus is in the transversely now. This is called the level of facial colliculus, and contains the abducens and facial nuclei. The facial nuclei are somewhat anterior to the abducens nucleus. The vestibular nuclei, they are medial, lateral, superior, and inferior nuclei. The lateral nucleus is the main source of the lateral vestibulospinal tract, while the rest give the medial longitudinal fasciculus in a paramedian position or paramedial position. This is a typo here. And the medial vestibulospinal tract. The MLF, by the way, it connects the cranial nerve nuclei together to coordinate their action. The cochlear nuclei, they are ventral and dorsal nuclei present laterally, receive cochlear nerve, and the axons decussate as the trapezoid body. This is the trapezoid body, as showed you in this section, the transverse fibers. And the fibers go to the ipsilateral and contralateral lateral lemniscus, which is part of the auditory pathway, and then to the superior olive. Well, the function of the superior olive in the auditory pathway is to determine the source of sound. It's important to determine the source of sound. It measures the time of the sound waves reaching the ear from the right and left sides, or from around the head, and it calculates that the difference, and determines from which direction the sound is coming from. Then from the superior olive and trapezoid nuclei and lateral lemniscus to the inferior colliculus, which is part of the auditory pathway, and then from there through the inferior brachium to the medial geniculate body or medial geniculate nucleus. Another nucleus is the superior and inferior salivatory nuclei. From their names, salivatory, they are responsible for activating the salivary glands. They are the parasympathetic supply for the salivary glands. The superior salivatory nucleus gives the facial, and inferior salivatory nucleus gives the glossopharyngeal. Remember from the head and neck lectures, the parotid gland receives its parasympathetic supply through the glossopharyngeal nerve, and the rest of the glands, like the submandibular and sublingual glands, they receive their parasympathetic supply through branches of the facial nerve. To be precise, it's the chorda tympani branch of the facial nerve. Remember that, the chorda tympani, that branch of the facial that joins the lingual to deliver it to the target glands. There is also in this area the spinal nucleus of the trigeminal expands to form the main sensory nucleus. And the medial lemniscus, this is the medial lemniscus, is in transversely now, which carries the fine touch and proprioception impulses going up to the brain. And the spinal and trigeminal lemnisci for pain and temperature from the head. Remember, the sensations from the head are carried through via the trigeminal nerve, while below the head from different nerves. And also it contains reticular formation nuclei. The upper part of the pons, it has the trigeminal motor nucleus and the main sensory nucleus of the trigeminal. It's lateral to the motor nucleus and continues with the spinal nucleus of the trigeminal. Its axons decussate and ascend in medial lemniscus to the thalamus. Remember, the nucleus of the thalamus receiving sensations from the head is the ventroposteromedial nucleus of the thalamus, while the ventroposterolateral nucleus of the thalamus receives sensations from the rest of the body below the head. We have the medial longitudinal fasciculus in the middle, the medial lemniscus adjacent to it, and the superior cerebellar peduncle with the ventral spirocerebellar tract in it. Well, there's a debate about whether the ventral spinocerebellar tract is part of the superior cerebellar peduncle or not. But in old books, it's part of it. It passes through it. The superior cerebellar peduncle. The rest of the spinocerebellars are in the inferior cerebellar peduncle. Reticular formation nuclei in the pons, they acquire names according to their position, like the nuclei Reticular, Spontus, Auralis, and Caudalus. Medial column of nuclei. There's also the Raphe nuclei, which are median, and Nucleus Pontus Centralis, which forms the lateral column of reticular formation nuclei. There is also the locus ceruleus, which is part of the limbic system and connected to it and the reticular formation. Okay, blood supply of the pons through the anterior inferior cerebellar artery, which is a branch of the vertebral artery or the basilar, and the basilar artery by transverse pontine branches while in groove on the ventral aspect of the pons, and the superior cerebellar artery, which is the branch of the basilar before the terminal branch, which is the posterior cerebral artery. Some lesions of the pons, Miller-Gobler syndrome. It's a lesion of the ventral part of the pons, so expect involvement of the abducens and facial nerves. So this will result in paralysis of the lateral rectus supplied by the abducens, and ipsilateral Bill's palsy, which is paralysis of the face muscles because of the facial nerve involvement, and also crossed hemiplegia because you saw that the corticospinal tract is in the ventral aspect of the pons. The Foveal Syndrome is the same as Gobler, but plus it's deeper. It goes deeper in the pons. So this means that there will be loss of position and vibration, means proprioception, because involvement of the medial lemniscus, and the conjugate lateral gaze because of the involvement of the medial longitudinal fasciculus. Lesions at the cerebellopontine angle, which is a common site for tumors, especially of the meninges. Acoustic neuroma. It causes deafness because of involvement of cranial nerve number 8. And nystagmus, the deafness because of the involvement of the cochlear component, and nystagmus because of the involvement of the vestibular component of the vestibulocochlear nerve. If the lesion is large, it involves the spinal tract of the trigeminal nerve, means the loss of pain and temperature sensation, ipsilateral, and facial palsy because of the involvement of cranial nerve number 7, which is the facial nerve. I hope you got the maximum benefit from this lecture, and thank you very much for watching.